we have many methods of connecting. You know, there's a lot of people who say, well, you know, why can't we just do this? And the answer is, there's a cost to connectivity. There's a lot of methods of connecting. We can do traditional point-to-point interfaces. Our back of the napkin, you know, just because we thought we'd spend a little time figuring out what the cost to the state of California was, if we had to connect all of our practicing providers, all of our ancillary providers. We stopped counting at about the $1 billion mark. It's a lot of money, it's a lot of effort. I mean, it's not just money, it's every one of those requires time and effort. So not only do we not have enough money to do this, the time it would take to get this accomplished, we've got to do better than that. And yet, we're not going to not use what's already in place. There's a ton of traditional point-to-point interfaces in place. How can we leverage that to more rapidly make this work? There's also the Nationwide Health Information Network, the Connect Gateway. This is the ability, it was specifically set up to be able to exchange information from one health information exchange organization or health information exchange infrastructure to another health information exchange infrastructure. We happen to have in the state of California 5 Nationwide Health Information Network Connect Gateway users, people who participated in both rounds of the Nationwide Health Information Network and the grant round that went with that. So Kaiser Permanente is one of those, Redwood MedNet, Santa Cruz Health Information Exchange, Western Health Information Network. California has amazing resources in innovation and pioneering of technology and connectivity. There's also the emerging federal direct project standards, which is starting to look like the way that we're going to be able to share patient care summaries, because some of the technologies have to catch up and they don't have the capacity to develop and share CCD documents. That must happen. It's not a question of which one of these do we do, it's how do we knit all of these together and all of the existing activity together to make it work? How do we connect the existing EHR vendors with the existing pharmacies and the providers who do e-prescribing and the people who do the lab information systems? How do we put them all together so that we do the highest quality connectivity and interoperability at the least duplication or multiplication of effort? I think that's Cali Connect's job. We're going to figure that out. We'll let you know by Friday. I wanted to do just a little bit of a deeper dive on the Nationwide Health Information Network. And this is such a brilliant example of connectivity and interoperability. And the reason it's important is because they acknowledge not just the technology side of things, which is the Nationwide Health Information Network and all of the protocols that go around the connectivity and the Federal Connect Gateway and all of the technical specifications, which is one half of the equation, and quite frankly, the easiest half of the equation. But it also marries it with the agreements and the governance that allows you to actually exchange the data amongst competing or different organizations. You know, if you're going to share data inside of your own 4 walls with your own providers who happen to be your staff, that's not such a challenge. Sharing your data across the street with the people who happen to be your competitors, that's just a little more of a challenge. And this is the kind of work that Cali Connect will be doing in California. We'll be leveraging all of these things that have already been piloted at the federal level, and then we'll be bringing it down here to the California level and saying, how can we use this to make rapid advancements? And I mean really rapid advancements. We expect to have significant shift in the in the capacity of health information exchange between now and the end of September of 2012. And that's a short period of time, but we're going to be very aggressive about moving the needle and making sure that we get many more people connected and many more people sharing the key priorities of data. And Cali Connect has been working very closely with the state of California and with the ONC around framing both the priorities of the HIE cooperative agreement and the methodology by which we will accomplish those things. So the ONC priorities, in fact, their mandate to us is establish a trust environment. Make it easy for people to exchange data and know what it is they're agreeing to when they exchange the data. Support the ancillary services, the lab systems, the pharmacy systems, public health. Make sure that they can actually participate in this healthcare environment that's now going to be electronic. And then coordinate, monitor, and report on the health information landscape, not at a high level, not at a general level, but really be able to say, we've added 1,000 providers who can now e-prescribe and deliver their lab data summaries to, or not their lab summaries, their patient summaries to their referring, the specialties that they're referring to. They want us to be able to literally measure that. They don't want us to extrapolate it. They don't want us to guesstimate it. They don't want us to use a statistical sample. They want us to be able to say, we really did this. It might take a little creativity. California's got a lot of people to coordinate that with, but we are working on that, and we're working on creating a framework so that we can do that. So how are we going to do that? So we've narrowed it down to 3 activities. You might notice that in the center of this triangle is something called Sustainable Health Information Exchange in California. Those of us who've been in the health information exchange business for a long time laughingly call that the Holy Grail. And yes, that is Monty Python's Holy Grail in the center of that triangle. So how can we get there? Well, the first thing we need to do is we need to work out governance. And I know a lot of people think governance in the world is your corporate ability to make decisions. And while having corporate ability to make decisions is really great, we're making decisions on the level of the state of California and all of the stakeholder constituencies. So when we narrow it down and say, what are we going to do for governance at Cal eConnect? We're going to establish policy, we're going to provide leadership, and we're going to remove barriers. And we're gonna start defining things so that we can actually take some ground. We are very committed to making incremental progress, and that's how our governance is gonna say, this is the incremental progress we're making on this timeline, and you'll start seeing those things come out of us. Out of our documentation, you'll start seeing us talk to those kinds of things. Our commitment is to be a continuous performance improvement organization, and we're going to measure this, and we're going to work with you so that you're comfortable that we're reporting to you the progress that we're making is accurate and that it's what you need us to do. The second leg of this is technical assistance. It's really about bringing together and providing expert support to select or develop solutions to problems. Governance will say, these are the problems we're going to address. Technical assistance is going to say, here's how we're going to address them. And then that third piece of this triangle is coordination. While some of the numbers that Linette mentioned, it is millions of dollars. And that's an amazing amount of money, and we're so grateful to have it. And it's a drop in the bucket for a group of people who have 38.6 million people in the state of California, all of the providers that we have, all of the connectivity we have to engender. It's really about conserving very scarce resources and making targeted investments and making sure that we understand the impact of those investments so that we can replicate it. Because really, we should be learning from all of the things that everybody's done, and where they're doing something really amazing in one area, we should export that and do that in another area. One of the sessions today is an innovation session, and that's exactly why we brought the people together, because there are some pockets of innovation in the state of California that are solving some of the most critical problems in healthcare. And we wanted to make sure that we gave those people a moment. Unfortunately, it's not as much as we'd like to, but they all have about 5 minutes to tell you about what it is that they're doing so that you can connect up with them so that you can learn from them as well. So the next, after we go to the question and answer period from this, the next thing that we're going to do is we're going to have some breakout sessions. This is where we get to put you to work. We appreciate you coming and listening to us, but one of the things that Cal eConnect and indeed the regional extension centers and all of the activity that's going on in the state of California is we need you to input to us and let us know what's working, what you need us to do, and how we can support you so that we can prioritize those things accordingly. So one of the things that we have to do for the Office of the National Coordinators, we have to update our California HIE strategic and operational plans. All of this activity is focused on getting us input so that when they give us the guidance, because they're going to give us plenty of time, which we assume is somewhere between 10 and 30 days, which for California may not be plenty of time. So that's why we're doing a little bit of this work in advance. And the other thing is that these breakout sessions and your feedback are going to help us in prioritizing our work for 2012. I'm going to do just a little bit of information about what the breakout sessions are, and then we will go to the question and answer session, which you can give, you know, not just us, but also Undersecretary David Maxwell-Jolly and Linette and myself. So very quickly, the breakout sessions are focused on the governance, which is around policy, prioritization, things like that, and that will be in room 202. There's the coordination, which is around making sure that we're coordinating all of the activities in the state. There's the technical assistance, which is, you know, getting the technology resources and prioritizing what needs to be done in order to support actual technical connectivity. There's the role of the regional extension centers in promoting interoperability in HIE. There is a technology, which is an emerging standards session. This is a deep dive. So for those people who have been looking at what do we need to do next, what's the next level of technical standards, that's what the technology emerging standards are. And then there's also a session on how state government can use health information exchange to meet their HIE needs. Okay. Thank you very much.